So I thought I'd set up today's sessions by just talking a little bit about what is qualitative research, especially for those of you today who might be new to this approach. So qualitative research introduces more than just a new set of methods. It introduces a different paradigm for approaching research altogether. It's an inquiry process that focuses on meaning and interpretation. It aims to explore social or human problems, and certainly medicine can be thought of as a social and human endeavor. And it's also a flexible method that allows research teams to respond to new and emerging topics over the course of a study. And that allows them to really learn from participants rather than just following pre-established topics of interest. It certainly answers certain types of questions about process, about how and why, for example, and it doesn't answer other questions, of course, such as prevalence. So qualitative research is really come to be seen as complementary to quantitative approaches and offers important new evidence that can help us to improve care. And finally, it's worth noting that qualitative research is not a homogeneous category. Qualitative research approaches range from a multitude of different designs that are grounded in disciplines such as sociology, anthropology, psychology, and philosophy, and also those that are grounded in the humanities, such as the growing base of arts-based approaches, or specific disciplines such as nursing. And many qualitative projects are also participatory, meaning that participants and communities are actively engaged in the production of new knowledge from the very beginning of research projects. And you will certainly see a wonderful diversity of approaches represented in the special issue and here today at this webinar. So I've said that qualitative research can help us to understand people's experiences. So just a few quick words about what does it mean to understand experience. Most qualitative research takes as its starting point that experience is not fixed or singular, and that participants' stories, therefore, cannot simply be retold descriptively or counted the way that we might in surveys. Instead, they must be interpreted, often using a theoretical lens. The goal of qualitative research is not to discover an absolute or objective truth, but to uncover what we often think of as narrative truth. And this then allows us to also discover or explicate how experience has been constructed historically, through policies, through social locations of participants. And that in turn allows us to investigate how structural issues such as poverty, racism, or gender, for example, inform people's experiences of pain and of healthcare. So I often think of qualitative research as being an approach that enables us to see phenomenon in context or people's lives in motions. And of course, pain is subjective. And as we and others have written elsewhere, that subjectivity is at the heart of the tension between biomedicine, which relies on objective measures and tests, and pain, which relies on people's accounts of their own experience. And I think that unfortunately, sometimes that tension has been part of what has led people's experiences often being dismissed by clinicians and others. Thank you so much again for joining us, and I will look forward to hearing your questions and feedback.